Hello friends. Recently a patient came to me with an issue that she was not able to lose weight. She is a diabetic and her sugar control is not good. And in spite of taking insulin, her sugars are not coming down. Now what is the connection between weight loss and sugar control? Weight loss will help in sugar control. By losing weight, your body will become more sensitive to insulin. But if you are already on insulin, then how can we reduce your weight? This is where confusion starts. See, in order to lose weight, you need to be in calorie deficit. In other words, you need to burn more calories than you are consuming. So in this case, I told her that in order to lose weight, you need to consume less food. And if you consume less food, then how will you take your injection? See, this is the dilemma she's in. How many units of insulin should I take if I'm eating less food? Do I need to change my diet? What kind of diet should I eat? These are some of the questions that I'm sure would have come to her mind. And sometimes these questions may not be very easy to answer, even for the doctor, because there is no textbook to tell us exactly how much dose of insulin a person needs if he or she eats less. So in such situations, we have to go by the principle of trial and error. We have to try out various combinations until we get the right amount of insulin dose and the right amount of food that has to be eaten so that you stay alive and do not feel hungry. At the same time, you should also lose weight and keep your sugar levels normal. Okay, so this is what we did. And after some trial and error, we finally found out the perfect combination of food and insulin that helped her not only to lose weight but also to control her sugar levels. Now, what exactly were the changes that we made in her diet plan? The first and foremost important thing is that we shifted her mindset. The way she thought about food and the way she thought about insulin also changed. Okay, so now let me share with you the mindset shifts that she did. And I'm sure that if you make these mindset shifts, it will help you to lose weight, it will help you to control your sugar levels, and ultimately, it will help you to reverse your diabetes. So let's see what exactly are those mindset shifts. Number 1, she used to think that I have diabetes, so I cannot eat tasty food. Or I have diabetes, so I need to eat bland food for the rest of my life. And I'm going to challenge this belief of hers. Let me ask you a question. Is it possible to eat tasty food and still remain healthy? Definitely. It is possible to eat tasty food and still remain healthy. It is just a myth that diabetic patients or pre-diabetic patients need to eat bland food for the rest of their lives. This mindset shift is very important. Once you believe that you can still eat tasty food, then your half the battle is won. Then you can actually start thinking in terms of what kind of tasty food you can eat so that it does not increase your blood sugar levels. For example, if you want to eat something sweet, don't just give up. Don't say that, oh, I have diabetes, so I'll never eat sweets again in my life. Rather, think of healthy desserts. Think of desserts that do not increase your blood sugar levels. There are so many options available today. You can just check online and see what kind of healthy desserts are available. Even I have made a couple of videos on healthy desserts. You can check them out. And once you make this mindset shift, you will not feel deprived of anything. You can eat all the varieties of food, and at the same time you will not compromise on your health. Okay, second mindset shift that she made is, she used to think that carbs are the enemy. Carbs are bad. I need to avoid carbs as much as possible. And now when she thinks about carbs, she says, oh, carbs are my friend. Carbs are my friend. Carbs are the best source of energy for my body. Yes, carbohydrates are the best source of energy for our body. Our brain needs carbs. Our muscles need carbs. In fact, every cell in our body needs carbs. And if you look at the history of human evolution, you will find that we have been eating carbs for the last 2 million years. Only when we started eating refined carbs, only when we started eating white bread, white rice, wheat, these are called refined carbohydrates. Only when we started eating these refined carbohydrates in excess, then problems started. So the problem is not with the carbs, the problem is with the type of carbs we are eating, and most importantly, the amount of carbs we are eating. So if you can select the right kind of carbohydrate, the complex carbohydrates, the unrefined carbohydrates, and if you eat them in the right amount, then they will do a world of good to your body. They will give you energy, they will give you happiness, and they will not increase your blood sugar levels. So now she looks at carbs in a very different light. She knows that carbs are not the enemy. She just needs to be mindful of the type of carb she's eating and the amount of carb that she's eating. Okay. The third mindset shift is that earlier she used to think that fat is the enemy. Fat is bad. I need to avoid fat as much as possible. And now she says, no, fat is my friend. Fat is the best. In fact, our bodies need fat to survive. It is just that the type of fat that we are eating, if it is the wrong kind of fat, then it is harmful for our body. So again, here, the problem is not with the fat. The problem is with the type of fat that we are eating, and also the amount of fat that we are eating. If we eat the right kind of fat, like omega-3 fatty acids, if we eat them in the right amount, then they will do a world of good to our body. They will decrease inflammation in the body. They will help in weight loss. They will decrease your blood sugar levels. So now she looks at fat in a very positive way. She knows that fat is not the enemy. She just needs to be mindful of the type of fat that she's eating and the amount of fat that she's eating. Next mindset shift is about protein. Earlier, she used to think that, oh, protein is important, but I don't need to bother about protein. But now she thinks about protein in a very different way. And now she says, protein is my friend. Protein is the most important nutrient for my body because every cell in my body needs protein. Not only that, if I eat protein-rich food, it will keep me full for a longer period of time. It will decrease my hunger. And if I decrease my hunger, then I will automatically take lesser amount of food. And if I take lesser amount of food, then I will be in calorie deficit. And if I am in calorie deficit, then I will lose weight. So now she looks at protein in a very different light. She knows that protein is the most important nutrient for her body. And if she eats protein-rich food in each and every meal, it will definitely help her to lose weight. And most importantly, it will help her to stay full for a longer period of time. And if she stays full, then she will not feel hungry, and she can skip in between meals snacking. So these are some of the mindset shifts that help this patient not only to lose weight, but also to control her sugar levels and ultimately reverse her diabetes. So I hope that if you make these mindset shifts, it will help you too. Remember, you can still eat tasty food. Carbs are your friends. They are the best source of energy for your body. Fat is your friend. Protein is your friend. It is the most important nutrient for your body. And if you eat the right kind of fat and protein and carbohydrates in the right amount, they will not increase your blood sugar levels. They will help you to lose weight, and they will help you to control your sugar levels. So remember, friends, food is not your enemy. It is your friend. And if you have a friendly relationship with food, then it will do a world of good to your body. It will help you to live a happier life. If you like this video, please hit the like button and subscribe to this channel. If you want to know how to reverse diabetes, please click on this video. Thank you.